Hello, welcome to animatedteeth.com and our discussion of post-extraction instructions for the first 24 hours after having your tooth pulled. Using this video, we'll point out some of the more important issues we cover on this page and absolutely feel you must be aware. At the very top of our list are two related items: controlling your extraction site's bleeding and then protecting the blood clot that has formed. If you've just had a tooth pulled, these two tasks are your primary job today. Period. That's because the foundation you lay during the first 24 hours following your procedure sets the stage for the healing process that immediately begins. Messing up these steps will prove to be a nuisance for you today, tend to delay your healing process for some days to come, and possibly even lead to a painful condition called a dry socket, an experience that most people ruefully remember. So, a stitch in time. Well, you know the rhyme. Despite that belabored warning, doing what you need to do to control your extraction site's bleeding is typically quite simple, uneventful, and just requires you to keep your mouth closed. Applying firm pressure to a wound is standard first aid in controlling bleeding. And that applies to wounds in the mouth too. At the end of your procedure, your dentist will place a wad of gauze on top of your extraction site and then instruct you to bite down on it gently but firmly. They'll then tell you to hold that pose for the next 30 minutes. And if you can follow those simple instructions, no yapping, no phone calls, no eating, no drinking, for the next 30 minutes, one of your day's main tasks will probably already be accomplished. Of course, even with the best laid plans, issues can arise and sometimes 30 minutes isn't long enough. And if not, the solution is to do more of the same. Dampen some of the extra gauze your dentist sent you home with, place it on top of your extraction site and bite firmly on it for another 30 minutes. Or even an hour. Better yet, instead of gauze, use moistened tea bags. After a cycle or two, if you don't see substantial improvement in your situation, it never hurts to be in touch with your dentist for advice and support. We guarantee you, however, the first words out of their mouth will be, "Have you tried a tea bag yet?" So, switch to that sooner rather than later during the process. The issue of protecting the blood clot that forms is pretty much just as simple. In this case, you just need to take things easy. And not just for this first 24-hour period, but really for the next few days too. As examples, you shouldn't vigorously rinse your extraction site. And don't be poking at it with your tongue, finger, or a toothbrush. Actually, you really need to read through our entire list of do's and don'ts because there are some activities that can lead to blood clot loss that you might not usually think of. This includes physical exertion, blowing your nose, and even just enjoying a cup of coffee or a bowl of hot soup. The first 24 hours following your extraction is also a time frame when you can take steps to help to minimize the level of swelling that ultimately forms. We discuss this issue on its own page, so look for that, but generally, today is the day that you'll begin cycles of ice pack application during your waking hours. We will point out that swelling isn't always an issue with all extractions. Sure, patients who have had an impacted wisdom tooth removed will be wise to initiate preventive steps. But for the average routine extraction, whatever swelling occurs will probably just be minimal and probably not noticeable. Ask your dentist what to expect. Of course, you'll still be numb after your extraction, and continuing on for the next few hours. That can interfere with your speech, or eating and drinking. But of course, you're not supposed to be doing those things immediately after your extraction anyway. Because of their numbness, some people inadvertently bite their lip, possibly even repeatedly. So, be careful, or, very importantly, keep your eye on your child if they're the one who has had a tooth pulled. Also, be sure to maintain proper on-off cycles if using an ice pack to minimize swelling. Otherwise, your numbness may keep you from realizing how cold your tissues are getting. There are additional first 24-hour post-extraction instructions that you should be aware of, so please take the time to read through this page. All of these instructions are important because, like we said at the beginning of this video, they help to set an ideal stage for the healing process that's starting up. So, take heed. As one last point, if you have questions or concerns, it's always appropriate to be in touch with your dentist. They are your healthcare provider, and not just by way of performing your extraction, but also in providing you with whatever post-operative care you require. That's their obligation, and no doubt an aspect of their practice that they take pride in providing. So, make sure to ask for their assistance if you need it.